We're all looking for that perfect 10, right? And on newborns, it's the same thing. And we're talking APGAR. We're gonna get this score every 1 minute and 5 minutes to trend and see how that baby's doing. APGAR stands for appearance, pulse, grimace or irritability, activity and muscle tone, and respiration. A perfect score is that perfect 10. And the way I like to do it is I think -1. If things aren't as it should be, I'm gonna subtract 1, and it looks like this. For appearance, we like those pink skins, knowing that perfusion is occurring. Pink is 2 points. If they're pink and blue, that's not quite right, -1. And if that baby is fully blue, that's a score of 0. Next, we go to pulse. They got small hearts that beat rapidly to move that blood. So we're looking for a pulse rate of above 100. If it's less than 100, -1, that's gonna give us 1 point. And if it's absent, no credit, we're gonna keep that as a 0. Next, we go to grimace and irritability. Babies are supposed to cry and move. That's normal, that's 2 points. But if it's got a weak cry and very little movement, we're gonna give it a score of 1, -1, right? And if there's no cry, we're gonna go with a score of 0. Next, activity and muscle tone. When you go to straighten a baby out, it should resist you. But if it's just a little bit of resistance, -1, not right. So that's gonna go to a point. And if there's no muscle tone at all, we're gonna give it that score of 0. And last, respiration. Kids have little lungs, so they have to breathe fast. And so we're looking for rapid respiration. If it's slow respiration, not quite right, we're going back with the -1 for 1 point. And if they're not breathing, that's a score of 0.